Hello, hello, everyone. Good afternoon. It's so nice to see you all, the people we can see on the screen. And we hope you guys are all doing great today. We're going to get started with our program as a few more people join, but we do want to be respectful for your time. So we welcome you to today's San Bernardino County Medical Society webinar presentation, Behind the Scenes with COVID Boosters. Do they really work and will they be annual? My name is Allison Elsner and I'm the CEO of the San Bernardino County Medical Society. This webinar is the third in our series of 7 that the Medical Society has been hosting and will continue to host between now and next spring, made possible through a very generous grant from the San Bernardino County Department of Public Health. We are super excited that today we have the representation of the This Is Our Shot campaign as our presenter. And this has become a national movement, as you know, so we will be introducing him in just a moment. All right, and before I do introduce him, I want to remind you all that you're welcome to submit any questions you have as we go along through the chat feature on your Zoom dashboard screen. Or if you want to raise your hand using the raise your hand feature, you can do that. And Dr. McDonald might take your question along the way if he sees it, but if not, we'll wait till he's finished and we'll go ahead and Soteria will facilitate your question and answers, and we will go through them one by one and make sure we try to get to you at the end of his presentation. And of course, if you're not speaking, we would really appreciate it if you keep your sound on mute. Thanks so much. So with that, I'm very honored to introduce today's presenter, Alex McDonald, MD, FAAFP, CAQSM. And as noted, he's the founder of This Is Our Shot National Campaign, which, as you all know, arose from the early stages of the pandemic as a culturally sensitive way to bring equity to patients in the context of getting vaccinated and fighting COVID misinformation. Dr. McDonald is a former professional triathlete, family and sports medicine physician at Southern California Permanente Medical Group, Kaiser Permanente. He currently practices at Kaiser Permanente Fontana Medical Center. Dr. McDonald serves several roles, including treasurer for the San Bernardino County Medical Society, yay! Officer for the California Academy of Family Physicians, YPS trustee to the California Medical Association, YPS specialty delegate to the American Medical Association, advisory council to the California Immunization Coalition, and as we mentioned twice, he's a co-founder and founder of This Is Our Shot digital grassroots healthcare movement to build vaccine confidence, combat COVID-19 misinformation, and guide providers and patients in achieving healthcare equity with regard to COVID-19 vaccinations and overall healthcare. His professional interests include exercise and physical activity, point of care ultrasound, health policy, and preventative medicine. Dr. McDonald holds degrees from Connecticut College, the University of Vermont, Larner College of Medicine, Southern California Kaiser Permanente, as well as Duke University. Dr. McDonald lives in Southern California with his physician wife, 3 children, and 3 dogs. He enjoys running, riding his bike, cooking, coffee, and I have to say this part that you always include, Dr. McDonald, 8 p.m. dance parties with his kids. And I assume you still do that.
It's just, it's their excuse not to go to bed, and they know they can get me excited by dancing, so.
Well, yours too. You can stay up late that way. And we should also mention, although most of you know this, Dr. McDonald is the selfie king. If anyone knows how to brilliantly leverage a simple photograph for maximum impact on social media, and I'm serious about that, it's Dr. McDonald. We've all learned a lot from this strategy. All right, welcome, Dr. McDonald, and we're excited to have you, and I'll turn it over to you.
Awesome. Thank you so much for that very kind introduction. Yeah, I might have to do a selfie during the webinar as well, too. So let me share my screen here. All right, can you guys see my screen?
No. Yes.
Okay, great. and stop me if the slides aren't advancing. So thank you. I'll skip this part. And this is maybe my selfie, maybe my selfie skills on display. And so I wear lots of hats and I do lots of things, but I'm a family physician and it's hard for me to just do one thing because I believe so much of what we do is impacted and related to one or another thing as well too. Let me get the chat up here too. So if you guys have questions as we go, feel free to drop them in the chat. I'll try to keep an eye on that as well too. But Soteria or Janice, please feel free to stop me if it goes. So I guess I should start also by saying that everything I tell you today could potentially change in the next day or two, and probably will. But we'll just kind of take it one step at a time. Again, I do have a couple disclosures. So I have no financial disclosures, but I am the co-founder and senior advisor for This Is Our Shot in Vikunitaya. My 3 children right there are fully immunized against COVID-19, as well as all routine childhood immunizations. And I'm an advisor to the California Immunization Council as well too. So we'll move along. So we're going to talk a little bit about the current state of COVID, vaccines and the vaccine effectiveness and the data we have thus far. We're going to talk about Omicron and the new booster, which was literally just announced last week, the new bivalent boosters. And then if we have time, we might jump into a little bit of conversations about how to have vaccine conversations with your patients, with your family members, with your colleagues, and maybe talking a little about mis and disinformation, which is obviously a growing topic as well in the future. And then if time, I'll give you the slide to look at. This is our shot in Vikunitaya. So I speak very fast. I get very excited. So feel free to raise your hand and I'll try and slow down if I can. But we have a lot to get through and hopefully this is going to be pretty high yield. And like I said, I updated these slides yesterday evening, actually, just to make sure we had the most current data. But as you know, things are changing very, very rapidly. And so what is true today may not be true tomorrow as well. So please take that with a grain of salt. Okay, so where we are with COVID right now. So right now, the BA.5, which is the predominant variant right now in the US, is really beginning to wind down. We've had about 15,000 US deaths the past 6 weeks. We're still at about 400 deaths per day. So even though most people have moved on from COVID and are done with COVID, COVID is not done with us. And I think that's a really important point here too. There's still 400 deaths per day, which in my opinion is unacceptably high because at this point we have very good tools to prevent these deaths. And I'll go into more of that later. If you're looking kind of globally right now, there looks like this BA 4.6 variant is sort of beginning to take hold in India and Australia, and this BA 2.75. Those 2 variants don't really have any major spike protein mutations. And so we don't really expect these 2 variants are going to cause much of a surge. Since so many people in this country have already been exposed or they've been vaccinated, they have at least some infection-based immunity or vaccination-based immunity that we're not expecting a huge surge or a huge issue with COVID, at least for the next couple months or so. But again, stay tuned. Anything could happen. The good news with this mostly recent Omicron BA.5 variant is that hospitalizations have remained pretty low, about 1.5 people for 100,000. So that's really good. And the key here is that vaccinations and boosting and early diagnosis and treatment are really the key to protecting ourselves too. And so you can see kind of at the bottom there some general trends. Everything is sort of case numbers, deaths, hospitalizations are all trending down and in the right direction right now, which is the good news. So again, we've been on this COVID roller coaster for the past almost 2 years now. The most recent surge here is interesting because we think only about 14 to 15% of true COVID infections are actually being reported. A lot of people are just testing at home, and those are not actually being captured in our public health data. People are just not testing in general, and they're just assuming they have COVID, or they're just not testing and just killing about their lives as well too, because they're irresponsible, but that's another issue. I won't get into that one. So really this most recent surge is probably much higher than where we've been. It may have been akin to this past winter surge, but the issue is that only a very low number are actually being reported. And similarly, the wastewater tracking system is also consistent with this as well too. So this surge is probably not massive. It definitely hasn't had the same impact in our hospitals and our health systems, but this past surge is probably a lot bigger than we think it is, quite frankly, just because of again, testing at home or people just not testing in general. But again, the good news is between vaccinations and Paxlovid and other sort of preventative treatment options, the hospitalization rates have stayed pretty low, and it's sort of been decoupled, if you will, from the infections. And so when we saw, the past couple surges, when we saw rates go up in the community of just prevalence of the disease, hospitalization rates went way up as well too. But again, here we've stayed pretty low. We've stayed around 2 hospital admissions for every 100,000 COVID infections in the population. So the good news here is that Omicron is not as severe, and vaccinations are really preventing that as well too, or the infection as well. So this is kind of the daily trends as well too. This is a little bit older data as well, but again, kind of we're okay right now. I think the other thing too is when we're looking at this from a population point of view and looking at different groups, there's a huge difference in terms of populations with the impact of COVID on them. If you look at that green line, especially our Latinx and our Hispanic population, they have a much higher incidence of getting COVID than a lot of our other colleagues as well too, for a myriad of reasons: socioeconomic, vaccine acceptance, just the nature of their work. People who can stay home and work on Zoom are probably safer than people who need to go into the office or into the warehouse every day based on their job as well too. So we know a lot more of our Latinx population have much more sort of blue collar jobs where they're needing to be in the office, they're needing to go out and can't necessarily isolate themselves as much too. Furthermore, we know that a lot of our Latinx patients live in multi-generation households as well too. And so that definitely bears impact too. If someone brings it home and grandma lives in the same house as them, the younger individual may not get as sick or sick at all from COVID, but grandma, grandpa who lives in that same household may as well too. And so I think it's really important here that we continue to keep an eye on the health equity here and how COVID has disproportionately impacted a lot of our more vulnerable populations and some of our minority populations as well too, for a myriad of reasons. Just looking kind of at the major kind of COVID variants that are going around in the last couple of years here, you can see the graph here. You see this BA.5 is by far the largest variant, has been this way for most of the summer and the spring, the Omicron variant. But you see that kind of gray blue, the BA.4.6 is beginning to kind of start becoming a little bit more prevalent as well too. But we're keeping a very close eye on this in terms of which strain is most prevalent in the community, and there's strains of interest and there's strains of concern, so to speak. So this BA.46 is probably not too much of a concern. It's of interest, obviously, but again, like I said, there's no major spike protein mutation, so we don't think this is going to cause a huge issue, but we're going to keep a close eye on that as well too. Okay, let's talk about vaccines. As you all know, I am pro primary care. I am pro preventative medicine, and vaccines are a huge piece of what I do every day in terms of talking to people in prevention. So if you look at, this is a very busy slide, I know, and it's very pretty, but it's hard to make sense of it sometimes. So if you look at, this is breaking down fully vaccinated individuals versus booster eligible versus booster received based on age groups, essentially. Because right now, well, as of last week, your booster depended on your age. I will talk about the new booster and how all this basically is now out the window now with this new bivalent booster. But basically, if you look at the population, a lot of people, 60+% of the population have been vaccinated with their primary vaccine series. Again, that's the first and the second dose of either or whatever vaccine or the single dose of those that are only a single dose. But basically 48% of people who are eligible, only 48% of people who are eligible have been boosted. And the reason that's an issue is because we know that because of the nature of this infection and this virus, basically your protection, your antibody levels are only elevated for between 3 to 6 months or so after either vaccination or inoculation with the illness and the virus itself. And so we know that a lot of these people who were fully vaccinated probably don't have very much, if any, protection anymore because they haven't been boosted. And then even worse from that, those people who are older, who are eligible for their second booster, only 34% of them have received the booster. And so I think we did a good job getting the first go around when we were in the middle of the pandemic, but we're going to have a much harder lift, so to speak, when we talk about boosters and we get people boosted as well too. So hopefully you all get some good information here that you'll be able to bring home to your patients, to your friends, to your colleagues as well too. So the takeaway point here is that, you know, vaccinated individuals and boosted individuals are 14 times lower risk of death than people who are not vaccinated. If you've been fully vaccinated in one booster, you have a 3 times lower risk of death based on your age group as well too. So the point here, vaccines save lives. There's an estimated 20 million people around the world who have not died from COVID because they've been vaccinated, or because we've got enough people vaccinated as well too. So these vaccines are extremely effective at preventing severe disease and death. And I think that's the bottom line. If you don't remember anything else from this topic, please remember this slide. 14 times lower risk of death if you're fully vaccinated and fully boosted, 3 times lower risk if you're vaccinated and just that first booster. And if you're not vaccinated, much higher risk of death from COVID. Furthermore, hospitalization, same thing as well, right? And so people who are unvaccinated have a 4.6 times higher rate of being hospitalized than people who are vaccinated. And now obviously, you know, things have changed over time, you know, first series plus a booster plus a second booster. So again, a bit of a moving target here, but you see that blue line at the bottom of this slide for the vaccinated plus boosted is much lower than that green unvaccinated line as well. Especially again, that this surge back in January was much bigger. This more recent surge this summer, obviously not as a virulent, not as severe disease, and so obviously that gap is not as big. But the point is, who knows what future strains are going to show us as well too. You know, this kind of goes again back to that equity issue too. So again, just like COVID has disproportionately impacted some of our more vulnerable populations, our vaccine and our vaccine messages has been less effective at some of our vulnerable populations. If you look at in the top there, the Latinx and the Hispanic population, only 42% have had their first booster. Only 11.5% of eligible have had their second booster. Black population 45 and 17% compared to, you know, Asian or Caucasian populations in the 60s. So huge difference here in terms of the messaging and getting these people vaccinated and boosted as well too. And so I think we really need to make sure we continue to talk about vaccines and we message about vaccines in a culturally competent way. I am a white male, and I am maybe not the best spokesperson for some of these populations. And so it's really important that we find members of these communities, members of these populations. If we can find a lot of my physician colleagues who are members of these populations have been very active as well. And if we can help and support them as well to really make sure we reach these populations with culturally competent messaging and information as well too. I think it's something that we all have to be a part of too. It's not just healthcare leaders or doctors or public health individuals from these Latinx or Black populations as well too. Again, same information, different format based on how you like looking at your data. But basically, if you look at people who are vaccine eligible versus booster eligible, we have some work to do. There's some pretty big differences specifically for our Latinx and our Black community as well. So, you know, data shows that individuals who are fully vaccinated and boosted have the best protection against severe disease. Bottom line, unvaccinated individuals have about a 5 times, 4.6 higher rate of hospitalization compared to unvaccinated. And unvaccinated people of all ages have the highest risk of infection and death. And so really, these vaccines are just incredibly effective. And I think that's the bottom line and the major takeaway here too. All right, so safety, obviously safety is a huge question, especially at the beginning. People were worried about safety, and I think this number is actually probably out of date at this point too, but over 600 million Americans have been vaccinated. This is probably the most monitored and scrutinized vaccine in the history of probably all the vaccines that have ever come out. Serious reactions to the vaccines are exceptionally rare. The real world data has actually shown that the initial concerns about anaphylaxis from people who had allergic reactions to anything, the initial studies actually showed it was a little bit higher. The real world data shows that a severe allergic reaction to the vaccine is exceptionally rare, less than 0.05% of individuals as well. A lot of people talk about the VAERS, the Vaccine Adverse Reporting Event System, which is open access, so anyone can post anything on there all the time, and it's not monitored in any way. So it's an open resource. So some people go and find that data and say, "Oh, look, this person claims X, Y, and Z from the vaccine." I think it's important to remember that correlation does not equal causation. And I think it's important that we are aware of these issues, that we monitor some of these potential side effects. But still, at this point, all the data we have shows that the risks versus the benefits of these vaccines are, it's a no-brainer. The benefits far outweigh the risks too. And hang on, my slides aren't advancing. So this is just an example too of this vaccine advanced reporting system. Somebody reported that the influenza vaccine transformed them into the Incredible Hulk. So again, that VAERS system is open access and anyone can report anything on there too. So just keep it in mind, take it with a grain of salt. So this data is a little bit old. This is from the spring, but basically this showed that the percentage of the US population with COVID-19 antibodies, either with infection-based immunity or vaccine-based immunity, was very high. So basically for younger individuals, especially, anywhere between from December 2021 to February of 2022, that people who were exposed to either the vaccine or the virus went from 44 to 75% versus 46 to 74. The point is, this past winter surge, a huge, probably about 60% of our population either had COVID or was exposed to COVID or developed antibodies from COVID. Again, this data is a little bit older, but basically, there's two groups of people in this country: people who had COVID or people who are going to get COVID. And so it's not a matter of avoiding it anymore. It's a matter of risk mitigation to make sure you do everything you can to prevent yourself from having a severe illness or severe disease burden from COVID as well too. But again, this does not necessarily equal long-term protection, right? So this data is from the winter, and at this point, 3 to 6 months later, most of those antibodies are probably gone, and so there's probably not a long-term lasting effect here as well too. And I'll talk more about that later as we get into the new bivalent boosters as well. Vaccines still our best defense. Okay, now let's talk about this new. When Alice and I were planning this webinar, we were sort of thinking what would be timely, what would be a topic, and is really serendipitous. I swear I had nothing to do with this. That literally on Thursday last week, these vaccines were approved. These new bivalent boosters were approved by the FDA and the CDC. So we're going to talk about these new bivalent boosters. So here's the thing: COVID is not just going to disappear. COVID is mutating very quickly, and we're likely still going to have large surges. We don't know exactly when or how. Hopefully, COVID is going to become more predictable and seasonal, kind of like influenza. So these two graphs kind of show the ways that vaccines can mutate. So on the right side of the screen there, on the A patient, this is how influenza mutates. It's kind of a ladder-like fashion. It's pretty predictable. We kind of go from this one to this one to this one. They're all kind of connected. That's how influenza mutates, and so we can make a pretty good educated guess about what the most likely strain is going to be dominant each winter. And we also know that the flu kind of increases in the winter and decreases in the summer. We have decades and decades worth of flu data with which to base this information on. So right now, COVID is not at that point yet. COVID is still mutating about 4 times faster than influenza, and it's creating all these different ladders and different offshoots as well too. And so you can see there was the Delta surge this winter, there's the Omicron surge this summer, there was the original strain in the purple down below. So there's there's not a predictable way it's mutating right now. It's mutating very fast, but we don't necessarily know how it's going to mutate as well too. So that's a really important piece to remember, that as we are coming up with these new boosters, that it's actually reactive as opposed to proactive. Whereas influenza, I just got my flu shot last week. We have a pretty good estimate, a pretty good guesstimate of what that strain is going to be, because it predicts it mutates in a pretty predictable fashion. Does that make sense? That's kind of a nuanced piece, but I think that's really important for people to remember as well. All right, Sadari is nodding. I'll take that as acceptance. All right, again, just kind of this COVID variants, we are basically looking at this retrospective. We don't necessarily know what's going to happen. We don't necessarily know. We know kind of when strains start to kind of take hold. We also don't have great global monitoring for COVID yet. We have great global monitoring for flu, and so we know exactly what type of strain is transmitting where and in what community and what prevalence. Whereas we don't really have that yet for COVID vaccines. So these new Omicron boosters, yay! I haven't been vaccinated. My booster was last summer, so it's actually been over a year. And so I'm a sitting duck right now. So I'm very happy to find out these new Omicron boosters are here. I'm probably going to go get mine tomorrow, actually. So again, this is a bivalent booster, which basically means it has two flavors of COVID. Half of it is the original spike protein mRNA process, and half of it is the B4 and B5 variants. And again, that B5 is about 90% of what the circulating virus right now. Both Pfizer and Moderna have been approved. It's important to note here, I'm going to be totally honest, these boosters have not gone through human trials. These are based on historic data, and basically they used animal models to show benefit and show immune response as well too. And the reason this is important is a couple-fold. This is how the flu shot is made every year. So the flu vaccine doesn't go through human trials every year. Basically what they do is they use historical data, they use animal models to make sure it works, and we have great safety data as well too. So with the bivalent booster, we have great safety data, because the only thing that changed is the spike protein, the mRNA sequence, to match more this BA4, BA5 variants. So basically what this means is we know this vaccine is extremely safe. We know the mRNA sequence. We tested in animals, in mice, to make sure it works. And this allows us to be much more nimble and respond in much more real time, versus if we had to do, 6, 9, a year, 12 months worth of human trials before we approve these vaccines, we would be so far behind the curve, it wouldn't even matter anymore. So I think it's really important to keep that in mind, that in order to be nimble, in order to make sure we're kind of addressing whichever variant is most active and most pressing and most at risk of this in the coming months or to year, that's why developing this new sort of system and normalizing this new systems of developing these vaccines is very, very important too. So who is eligible and when? So the Pfizer version is eligible for anyone 12 years and older. I have a 12-year-old. I'm going to get her vaccinated like next week. Moderna is only 18 years and older. And so Moderna is only for adults, unfortunately. Basically, you're eligible for this vaccine basically about 2 months after your last COVID vaccine or booster. Or you can actually get it anytime actually after a COVID infection itself too, at least 10 days after COVID infection. However, if you've had COVID, we know you probably have some infection-based immunity and antibodies present for about 3 to 6 months or so, right? So people who've had COVID in the last 1 or 2 months from this last surge, I'd say, if you want to wait for 1 or 2 months to get your booster, that's probably fine in the grand scheme of things. And that way we can get people like me who haven't had COVID recently, haven't been vaccinated recently, we can get ourselves our more vulnerable populations or people who haven't been vaccinated recently to get them this new bivalent booster. Literally, it's now. Like, go to CVS, go to your local pharmacy. They're here this week too. I think it's important. Oh, I'll say this here. Like I said, boosters really are the most up to date and provide the best protection, especially this winter when we don't know what's going to happen, honestly. It reduces the risk of severe disease, hospitalization, and death, and then really provides the best level of protection against whatever that dominant circulating virus is right now. Everything else is the same. The only difference is that mRNA sequence. And so all the safety data, all the information from our prior vaccines, COVID vaccines, still hold true. And like I said, it's been the most scrutinized and examined vaccine probably in the history of the world, honestly. It is important to know this, the bivalent booster has a lower mRNA dose than the original vaccine. And so this is only approved for the booster. You need to get your primary vaccine series first. So that's 2 shots. If it's Pfizer or Moderna, and then 2 months later, you can get the new booster as well. The other thing too is all the other boosters are no longer authorized. This is the bivalent booster is now the only FDA approved booster. And so I think, oh no, I have a picture. I'm a visual person, so I have a picture later that'll I'll talk about this too. So basically all the other booster information about, you need a booster 4 months after, and then another 2 months after if you're high risk or immunocompromised, all that booster information is now no longer applicable. And there's only one bivalent booster, which essentially every single person in the country 12 years and older is now eligible for. It's an important point. Okay, so I'm going to literally go through some questions. I got tons of questions on my social media accounts. As Allison said, I have a social media use disorder. I'm working through it. I'm getting help. Don't worry. I got some questions on all my posts, and so I'm literally just going to go through some of these most common questions. So my last booster was November 2021. Should I get my booster now or should I wait? Basically, it depends on you. Yes, you're eligible 2 months after your prior booster. You can get it now or you can wait a month or two, but you don't want to wait too long. So here's the issue. Like I said before, these kind of BA 4.6, BA 0.275s likely are not going to cause a huge surge in the next couple of months or so in the US, but we could be wrong. And so the sooner you get vaccinated, the sooner you're protected. But if you get your booster now, we know 3 to 6 months later, you're going to have some waning immunity. And so again, I'm going to get my booster now because I feel like that's the best decision for me. If some people want to make sure they have a little bit higher protection or higher immunity come, January and February, you may want to wait a month or two before you get your booster. But again, it takes about 2 to 4 weeks for that immunity to build up after the booster. And so I tell people don't wait too long because by the time we're in the middle of another COVID surge, it's probably too late to get your booster at that point too. I had COVID in July. When should I get my booster? Basically, you likely have 3 to 4 months of protection after the COVID infection. You don't have to wait any longer than 10 days after COVID to get the booster. But if it's been July, August, September, October, probably getting your booster in the next month or so is probably a good idea. Oh, Dr. Walk said, my turn still not updated for boosters less than 50. Yeah, so a lot of the websites are not updated yet. This is, again, literally this is brand new as of like last week, and a lot of the websites are not updated yet. So yeah, I ran into the same problem when I was updating this presentation last night. So thanks for pointing that out, Dr. Wolk. Patient 29 weeks pregnant, should she get the new booster? Basically, ACOG still recommends everyone should get vaccinated and boosted once eligible. Again, this has not been updated yet to be specific about the bivalent booster. But again, based on all of the safety data, based on all the recommendations thus far, these vaccines are probably very safe during pregnancy, and also help impart immunity to the newborn as well, too, who's not going to be eligible to get vaccinated from COVID for the first 6 months or so also. I'm nursing my 6-month-old. Should I get the new COVID booster? Yes. Done. I got a 3rd dose of Pfizer. Should I get Moderna or should I stick with Pfizer? So I had my first 2 were Pfizer. My booster was Pfizer. There's been some people who say you can mix and match. You can stick with the same. Just get whatever's available. And so, like I said, I'm going to go tomorrow. And if Pfizer's all they have, I'm going to get Pfizer. If they have Moderna, I'm going to get Moderna. If I had a choice personally, since I had 3 Pfizer, I'll probably get Moderna just for maybe a little bit of kind of cross pollination. They're a little bit different maybe in terms of their immune profiles, but bottom line, just get whatever's available. The vaccine you get is more effective than not getting vaccinated overall. Are there side effects? So this is a good question. So basically, whatever you experienced for your prior booster is probably what you're going to experience for this booster as well, too. Again, I'll use myself as an example. Like I said, the mRNA level in the booster is lower, and so you're less likely to get severe side effects. But for my first My first shot, I felt very little. For my second vaccine in the primary series, I felt terrible for about a day, and then I felt fine. My booster, I didn't really feel much at all. And so whatever you had from your prior booster or your first vaccine is probably what you're going to feel. So if you were in bed for a day with fevers and chills and muscle aches, that's probably what you're going to experience. If you didn't have many side effects, that's probably what you're going to experience too. So everyone's a little bit different. But keep in mind, these side effects last about 24 to 36 hours. And then they're gone, and your body starts producing those antibodies too. So like I said, just plan accordingly. Maybe you want to get it on a Friday or not before any major events or trips as well too, just in case you do have some mild side effects for the first day or two. All right, should I get the old booster first or the new bivalent booster? And so again, the new bivalent booster, try saying that 5 times fast, will offer the best protection, and it's the only vaccine authorized at this point. The prior boosters are no longer eligible. And so if you go somewhere and you ask for the booster, you are not allowed to get it. They're not allowed to give you the prior booster because it's no longer authorized by the FDA. The new bivalent booster is the only one authorized. So you don't even have a choice. Why weren't the new boosters tested in humans? And okay, this is kind of what I went into before. This is a bit of a long answer. So again, we have extensive safety and efficacy data on the original or the OG COVID vaccine, but that strain is really no longer circulating or a major public health threat. So to speed the process and protection before what's likely going to be a winter surge, animal models were used. So nothing has changed other than the BA.4/5 mRNA sequence. And this is consistent with how the flu vaccine is developed every year as well. And then second part, they are doing real world testing in humans for efficacy and safety of the bivalent booster. But again, we have enough information that we feel confident that we can start providing these boosters now, and also at the same time test the real world efficacy also of how of what this is going to look like and how it plays out in the real world too. I have a 6 and 8 year old, can they get boosted? Unfortunately, no. So you got to be less than 12. They still need the OG vaccine, but they're not eligible for the OG booster, unfortunately, either too. I never completed my first 2 vaccines. Can I get the new booster? No. So you need to do the primary vaccine is still 2 doses of the original vaccine, and then 2 months later, then you're eligible for the new bivalent booster. That's an important point I think we need to remember. I think most people at this point, if they haven't had the primary 2 vaccine series, it's going to be a heavy lift to get them boosted, quite frankly. If they haven't been vaccinated at this point, there's probably some determination which may be hard to combat, or some misinformation which they've latched onto, which can be hard to combat. But again, I digress. Will this booster protect against future variants? Depends. It depends on what future variants look like. That's the bottom line. Again, like I said, this is still going to be our best protection, but we just don't know yet what those future variants will look like, and I'll talk about that in a little bit minute. So this is those of you who are out here who are visual learners. So for children 6 months to 17 years, they are eligible for the primary series. This booster is no longer eligible, and so anyone 12 years and older can get the Pfizer bivalent booster. Again, not the Moderna, just the Pfizer. And then this is the vaccine schedule for immunocompromised adults. Again, the primary series plus a booster plus another booster. So again, all these boosters are no longer authorized, and this is all null and void. And so all of these populations are eligible for the bivalent booster 2 months after their last COVID vaccine as well. And then this is just this is for immunocompromised adults, I apologize, who have that 3rd dose in the primary series. And then the same thing with the bivalent booster. So what's next? We have annual flu shots. We're going to have annual COVID vaccines. I think Tuesday, it was Tuesday, the White House announced, they're going to do annual COVID vaccines, which I think is probably a relatively good guess. But really at this point, it's probably just a guess. I think it's probably honestly a little bit premature to say that we're going to do annual COVID boosters at this point. I think from a sort of a public health messaging point of view, that sort of makes sense, and it makes easy. We know we need to get a flu shot every fall, and if we kind of add the COVID vaccine, COVID booster to that as well, it sort of makes sense. but I don't think we're quite there yet. Again, like I said, COVID is mutating about 4 times faster than flu is as well. It's not mutating in that nice ladder-like pattern. It's kind of all over the place. And so we don't yet have good predictive estimates of what the major strain is going to be every year. Again, I think, honestly, if I were a betting man, I'd say, yeah, probably COVID is going to probably become seasonal at some point, just like the flu. It's not there yet. We're probably going to, at some point, get good predictive analytics, good kind of estimates of how COVID is going to mutate. So we'll probably get there at some point, but honestly, just from a medical point of view, I think it's probably a little premature to announce that yet. So just for what it's worth. But again, unfortunately, the politics and the science have gotten intertwined at this point. It's very, very challenging to remove one from the other, just for what it's worth too. So like I said, maybe there'll be a flu-vid vaccine next year where we have a combined flu and COVID vaccine. These actually are under trials right now, actually, from some companies as well too. So, all right, I'm going to stop there. This is I'm going to talk more about vaccine messaging here, but I'll try and answer some questions in the chat if that's okay.
We do have a couple that are in the chat right now.
Please, yeah.
Yeah, we have actually a lot in the chat.
Yeah.
So yeah, you're going to go back to the beginning. So right? Yeah.
Yep, I'm in here right now. One is, can you get the booster and the flu shot at the same time?
Yes, you can. Yep. COVID booster. Initially, when we were first doing analysis on reactions and side effects, we didn't want any other vaccines around the same time as the COVID vaccine. At this point, we have very good data. We have very good safety information. It's completely safe to get the flu and the COVID vaccine together at this point.
Oh, perfect. And how long does the new booster last?
It depends. Like I said, probably somewhere in that 3 to 6 month time frame. Everyone's a little bit different. Younger, healthier people tend to mount a more robust immune response, and so they may have antibodies a little bit longer than people who are maybe older or frail. They tend to have a little bit shorter antibody window. So it depends, I guess, is the short answer. But 3 to 6 months is 3 months is probably a very reasonable time frame to have a reasonable expectation. And the other thing too is it's not like it suddenly shuts off, right? It's a slow decline of those antibodies too. So a number of factors get involved too. So I know I'm going to go off on a tangent. I kind of use the driving analogy, right? So you can get in a car accident at any time, right? So you can get COVID anytime. But if you're wearing your seatbelt, if you have airbags, if you're driving the speed limit, if you're paying attention, you're not on your cell phone, all those things mitigate your risk of getting into a car accident as well. COVID is the same way. If you're wearing a mask when you're in indoor crowded places, if you're having good hand hygiene, if you're getting good sleep and exercising, if you're getting vaccinated, all those things mitigate your risk as well too. You can still get COVID, but it just depends on your level of risk too. And so for people who are relatively low risk, I say you probably are going to estimate 3 to 6 months. People who are higher risk, more medical complications, I probably say about 3 months of protection, generally speaking. But again, that's highly variable as well.
And I know that you did touch on this. Allison asked a question. How can the bivalent booster be approved without human trials? Has this been done before with other treatments and vaccines?
And you pretty much answered that.
Yeah, you did. Yeah, you've already touched on that. So let me keep going. So the formula or ingredients in Pfizer versus Moderna are different?
No, I mean, just the formulation is a little bit different as well too. And so there may be a little bit differences in how some people respond to one versus another. They're basically about the same. The level of mRNA in the original Moderna vaccine was a little bit higher than the Pfizer vaccine. So again, it's a very nuanced point. I don't think it makes a huge difference. Like I said, the best vaccine is the one you can get. And so it doesn't really matter which one you get.
And then the next one is, if someone got only one vaccine 8 months ago, they have to start over with the process of the first 2 vaccines?
So I'm going to, if Dr. Secure is on the line, he may know this better than I do, actually. So I'm going to say this with a grain of salt. I think if you've had one of the primary series, I think you now can get the second vaccine in the primary series, and then 2 months later, you can get the bivalent booster. So you don't have to restart the primary series, but you need to complete the primary series. If I think that might change, and I may be misinformed, but I think that's my understanding.
Okay.
Was that enough hedges? Did I cover myself from a legal point of view?
Yeah, I know, right? And then we have, do you have any data on vaccination and long COVID?
Yes, I don't have anything on this presentation, but there's actually good data showing that people who've been vaccinated have a much lower risk of getting long COVID as well, too. And there's some anecdotal evidence that hasn't really played out, but there's some anecdotal evidence that people who have long COVID and then get boosted or get vaccinated have improvement in their long COVID symptoms as well, too. That's, again, not quite ready for prime time, from my understanding. But there is good evidence showing that having been vaccinated significantly reduces your risk of developing long COVID also.
Any insight on Novavax?
So I'm not too familiar with Novavax. It's a different scenario. It's, again, just kind of the primary, it has just the primary series right now. It's much more, it doesn't use the mRNA technology, so it's much more akin to a lot of our prior vaccines, and so it's a different process. It's been shown to be very effective as well too. The people who produced it are really pretty incredible and amazing people who've really donated a lot of their time, money, and energy to really, especially to countries who are less who have fewer resources to financially support this vaccine as well too. So Novavax works very, very well. I don't know a lot of the details about it too, and there's nothing come out yet about a booster for the Novavax series yet.
Thank you. And that's all that I have in the chat for right now.
Okay, sounds great. Well, it looks like we have about 12 minutes left. So I actually want to go through just some messaging and some ways we can talk about vaccines and sort of normalize some vaccines as well too. So I think it's important that we have these conversations, right? And hearing information and experiences from friends and family and other trusted people is really, really important. That was the whole movement behind the This Is Our Shot vaccine back in December of 2020 and January 2021, when we were all getting our vaccines and taking vaccine selfies and posting those online. We were helping to kind of normalize the getting your vaccine and taking that, making it a public display of community and public health. So I think it's really important that we all do this within our own circles, with our own family members and friends, and just talk about this as well too. Basically, the data and the studies that support vaccine safety and efficacy and claims can help. Facts and statistics are not a huge motivator for people. It's about the emotion, it's about the personal relationship, which is really valuable. So data and facts and statistics help, but and specifically for our younger individuals who may not get as sick. But again, it's about that communication, that relationship more than anything else. Always talking about vaccines significantly reducing transmission, significantly reducing high risk populations as well. And if we think about getting our whole community vaccinated, then we're going to be a lot safer too. I kind of use the analogy, if you lock your front door but you leave your window open, it kind of defeats the point. So we all have to do our part. We all have to lean in to do the work to really protect everybody, particularly our younger individuals who can't get vaccinated or boosted, or our very elderly individuals who are very high risk, regardless of whether they're vaccinated or not too. And I think, kind of, again, getting that connection, getting that emotion has been shown to be effective too. When we talk about vaccines as a way to kind of get back to normal and get back to safety, at this point, again, we're kind of back to normal at this point, and most people don't really care, but COVID's not done with us, even if we're done with COVID, as I said before. And so kind of talking about, getting back to normalcy and our missed moments, and then also getting back to traveling in large events and concerts and sporting events, not as big an issue now, but for people who are high risk, who are more concerned, getting vaccinated definitely helps reduce the risk here and helps us do all these things with some respect. I'd be remiss if I didn't say something about masks. Masks have been completely politicized, and it just drives me nuts. Masks work, right? Especially surgical or N95 masks. Again, this is a study showing people who the infected person wearing a mask and the non-infected person wearing that mask. And if you both wear N95 masks, you have to be in contact with them for 25 hours before you really have higher risk of getting infected. Even if one is wearing a surgical and one is wearing a surgical, it's 1 hour too. And so even wearing a surgical mask or an N95 or a KN95 helps significantly reduce the risk, even if the other person is not wearing the mask too. So when I'm going on a trip in 2 weeks, I'm going to wear an N95 mask on the airplane, especially, and in the airport too. So I think masks are effective. It's really easy. And there's a lot of BS about masks right now. So I'd be remiss if I didn't say that. So tell your friends. Language matters when we talk about vaccines, and I'll just sort of leave this here. So use the word vaccinations, talk about being safe and effective. Things are obviously changing rapidly. And so talk about getting the latest information, talking about, keeping family and friends safe seems to be more of a strong motivator than keeping your country safe, even though it's a huge public health and safety issue. Talk about public health. Don't talk about governments or scientists. For some reason, they're not very trusted. And talk about health experts and doctors. And then don't refer to people who are crazy or anti-vaxxers. Talk about people who have questions, because it's reasonable to have questions. If you don't have questions, I'd be more worried. And when the vaccines first came out in December of 2020, like I was a little bit nervous at first too, and I had questions about these new vaccines also. And so, but then once I learned more and asked some of these questions, I felt better too. So language matters, and so just try to keep your language on that left side of the screen here. I'll skip this just for time. So the hierarchy of information here, people need to think about safety first, and then effectiveness, and then sort of the development process. And so I think the biggest bang for our buck when we're talking about vaccines and we're talking to our friends, our family, our colleagues about how we can be vaccinated safely, how we can be vaccinated, talk about safety. Safety is the biggest thing. Talk about how millions and millions of people in this world, billions of people in the world have been vaccinated against COVID at this point too. And it's extremely safe. And then you can talk about lower risks of severe illness and death and hospitalization. And then you can talk about all those other pieces down the road. But really, safety should be the number one thing that comes up. And really just asking questions about that too, I think is an important piece. I think it's important just to remember that vaccine hesitancy is not an all or none, it's a spectrum, right? There are a lot of people who are just going to accept everything and just be the first in line. There are a lot of people who are going to refuse everything, and no matter what you say, they're going to have these sort of entrenched beliefs, right? But then there's about 60% of the country who's in the middle, right? 20% on either side, 60% of the people are in this middle zone. And those are the people who are open to these conversations. Those are the people we really need to kind of reach out to and talk to as well about these vaccines. I'll skip this for now, but this is just kind of a little mini framework about how you have these conversations about vaccine, be it in person or in the exam room or in the hospital or at your church or the grocery store or on Facebook, whatever groups you're at. Start with a conversation and ask the question, listen to what their concerns are, and then really focus on the common ground, right? Don't necessarily jump right to the vaccines. Everybody wants to be safe. No one wants to get COVID. No one wants to be hospitalized. Find that common ground, and then just kind of hammer home the 5 key messages, which I've said multiple times already today. And then afterwards, acknowledge that it's always their personal choice. What I tell people is I want you to make the best choice for your own health, but I want those choices to be based on good information. And I want you to get that information from a trusted and a reliable source, not Google or your cousin or your uncle. Everyone has a crazy uncle for some reason. I don't know what that is. And then also lastly, keeping those lines of communication open too, and saying, hey, if anything else comes up, you have any questions, let me know. And you might not change you might not change their mind in that one conversation, but you get them thinking, and then you have a follow-up conversation. I can't tell you how many patients I've had who initially don't want to get vaccinated for any of the vaccines, not just COVID, but we have the conversation, we have another conversation, and over time they eventually get vaccinated. It's been very gratifying to see it over time too. I'm going to skip all this just for the sake of time, because this is a lot of information about kind of what we've done with this as our shot, talking about the information demic or the infodemic and what information is and how it spreads. So there's misinformation and there's disinformation and there's malinformation. Misinformation is just false, but it's not created or shared with the intent of causing harm, versus malinformation is completely false with an intention to inflict harm on a person or an organization, and disinformation is somewhere in the middle. It's false and it's deliberate to cause some kind of harm intentionally. And I think the key here is who spreads inaccurate information. All of us, we all do this, right? And I think we all have a role here in stopping this misinformation, whether it's on social media, whether it's from the government, whether it's different industries, whether it's private messaging apps, whether it's the media. Everyone is spreading disinformation in some way because we all have our own biases. And it's important that we all lean in and we all say, before we click that like or that share button, we say, hey, is this accurate? Like, check the date. Is it from 2 years ago? Does it seem reasonable too? And how many times have you shared an article without actually reading it, right? So we're all guilty of this to some degree. And so I think we all have a role here when it comes to spreading accurate information and stopping the spread of misinformation too. So I'll skip through this too. Okay. Bivalent boosters are now available age 12 and plus. Get it done. It's the only bivalent, the bivalent booster is the only available booster right now. It's going to provide the best protection against this winter, no matter what happens. You're eligible 2 months after your last COVID vaccine, and we suspect some people are betting on an annual COVID vaccine, although it's a little bit premature for that, quite frankly, and continue to have these conversations. So please, this is our link to our homepage. This is our shot.info. We have these conversations online, individuals. We have a weekly newsletter, which goes out to all of our subscribers to share up-to-date information about what's coming, what's most accurate as well too. So please grab a screenshot of this, like us, share us on our social media channels as well. This is our shot, and Vikunateya. And thank you so much for having me. I hope this was, and it was a lot of information, but I hope it was high yield and you guys got something out of it.
Wow, Dr. McDonald, that was fantastic. You see, I told you in advance it would be good, and it was. That was really awesome. And we're already getting comments in the chat saying how amazing it was. Thank you so much. A lot of time and preparation went into that as well. So I want to just ask a really quick question of you. This is a question we will get. Will your slides be available to share, or are these proprietary? They will?
No, absolutely. We'll definitely share this. I'll get this to you guys and be happy to share this. Please spread the gospel. This is going to take all of us. It's not just about one of us. It's about all of us doing this work.
Okay, that's really helpful because there were some really valuable stats in there. So everyone on with us today, we are going to send you a copy of this recording as well as a copy of Dr. McDonald's slide deck. And we encourage you to keep track of what's going on with us and our upcoming events on SBCMS.org. And please to continue to follow our Facebook page. We have so much valuable content, including a lot of things we share from This Is Our Shot, and a lot of updates and announcements on there. We have a couple of webinars coming up. We think we're going to be doing a webinar on long COVID, date to be announced. And we do have a special monkeypox treatment, symptoms, vaccination webinars on September 28th. So thank you again so much. Thanks everyone for joining us. You're wonderful. And Dr. McDonald, thank you very much. Round of applause. Outstanding.
Thank you all. I really appreciate your time.
All right. We'll see you and we'll see everybody real soon. Have a great rest of your week and weekend. Bye-bye.